As I look upon my life, there's a passion inside. Heaven knows I'm living my dreams. As I look upon my life, there's a passion inside. Heaven knows I'm living my dreams.
Good morning, Dumelang. Okay. Yeah, you are on the Inside Show this morning with none other than Talk with Joan. That is your host this morning. And yes, it's a Thursday morning. And girlfriends, boyfriends, you know how we do it on a Thursday morning. We are looking into the mirror. And I know they say when you want a blonde to lose herself, you must put the mirror at the bottom of a pool. If you want to drown a blonde, put the mirror at the bottom of the pool. What endometriosis is, please, I ask you, just send the link and link her to YouTube on the Inside Show. And so, yeah, let's go to the mirror. Take out your mirror in your bag. I know you're in your room, you're working from home, but I know there's a big mirror. Dr. Mary had the biggest mirror in the room. And that mirror reflects everything there. I even see Christmas trimmings there. So, yeah, let us go. So I'm going to ask, first and foremost, maybe if my guest, Kim, if you can tell me, who's reflecting back into the mirror? If you look at the mirror, who's the lady reflecting back, and what is she feeling this morning? So yeah, over to you.
Thank you so much. Thank you so much, Joan. Thank you to all our viewers this morning for tuning in. My name is Kim Jacobs. And this morning when I look in the mirror, I see a brave, strong, resilient, humble, fighting woman of God. I'm super excited to be here this morning. I'm so excited to share my journey with our viewers this morning. And yes, I see a warrior.
Amen. Yay. Dr. Mary, what do you see when you look into that big mirror?
Good morning, everybody. I see somebody who's courageous, fearless, somebody who doesn't give up, and somebody who's ready to take on a challenge.
Awesome. Now you know what? There are two ways of spreading light. And it is to be the candle or the mirror that reflects it. Right? You know, Lady Gaga actually have a quote on a mirror. And she says, trust is like a mirror. You can fix it if it's broken, but you can still see the cracks in that reflection. So when we look into the mirror and the mirror is broken, there are different images looking back at you of the same person, right? So you can either fix that mirror, but remember, it is still broken. So I don't know about you. What do you see in a mirror today? There's another quote that I really love of a mirror that John Joseph Powell says. He has a quote that says, "It is an absolute human certainty that no one can know her own beauty or perceive a sense of her own worth until it has been reflected back at her in the mirror of another loving, caring human being." So that is actually what it is all about here today. So I don't know who is reflecting back into your mirror, because sometimes I know when our spirits are down, we don't actually want to look into the mirror. But this morning, just go to that mirror and affirm that girl, affirm that boy looking back into that mirror and say, I am a strong person. I know I can take the world on. I'm going to face this thing with everything that is within me, and I'm going to fight like a warrior. Right? You're a soldier in the army. So come on, boy, girl, come on, fight it, fight it. You're going to make it, and you're going to make it strong. So yes, we have with us our guest, and this is we have a guest in our studio. You don't know this. You don't know what happened now. Don't worry, it is okay. Please, can you introduce yourself? Tell the listeners who you are and what you are about.
Well, good morning, everyone. Good morning, Joan. Thank you so much once again for having me here this morning. It's such a privilege and an honor for me to have this platform. I'd like to observe all protocol. Also, just to thank my visionaries, Pastor Eden and Pastor Xenia, for allowing me and affording me the opportunity to be here. So this morning, I'm married to Delon, by the way, for 11 years.
Yes.
I'm from El Dorado Park, so I'm a girl from the south. So I've got endometriosis, and I'm here to share my story. So yes, I'm excited to be here once again.
Awesome, wonderful. Yes. Over to you, Dr. Mary. If you can just introduce yourself to the listeners so they can actually know who is that girlfriend on the other side.
I'll just take off my mask for a few seconds so that you can see me, and then I'll put it back on. That is Dr. Mary Adam. I'm a medical doctor, medical officer that's working in the Department of Obstetrics and Gynecology. That's my field of interest, and that's what I'm aiming to specialize in full-time. And I practice at Chris Honeyberg Warnoth Hospital. I do an outreach as well to El Dorado Park, and I create links between our community and various hospitals so that women from all backgrounds, particularly my community, El Dorado Park, have access and the freedom to express themselves in this way. So thank you very much, Joan, for allowing me to come onto this platform and to be part of this talk, because it is a well talked about but not well understood condition. And I thank you, Kim Jacobs, for coming on and sharing your story. I'm glad to walk this journey with you.
Thank you so much, Dr. Mary.
Really appreciate you, girlfriend. Now, yes, this morning's topic is my life with endometriosis, right? So yeah, endometriosis is a really a thing that a lot of women are suffering with. And you know what? I found in the beginning of my married life that, yes, did not know at that time that you know what, maybe there is endometriosis in my body. I did not know, and almost, going for 2 years into my marriage, and then only I fell pregnant. But yeah, beloved, you find people that is very insensitive that will come up to you and ask you questions like, so now, you married, so where's the children? When are you falling pregnant? Insensitive questions like that. And I find that this is a battle, and this is actually a fight that most women or many women have. And I actually did a research. They say it's 176 million women that is globally, that is struggling with endometriosis. So it shows you that this is really a topic that is long overdue, so that we can understand actually not to ask insensitive questions. You know when someone actually don't have children and is married for long. Kim said she's married for 11 years, and up till today, I'm sure you still get that questions
all the time.
Right,
Yes,
and
a lot
what
of
is your
people.
reaction on that?
So it's all in God's timing. In the beginning, it was extremely frustrating. It was embarrassing. It was painful to approach people that comes. They want to touch you. They want to, rub your tummy. Are you okay? They want to pray over you. They want to do a lot of things. But now I've learned to deal with them.
Absolutely, yes.
I've learned to answer them in a beautiful way, that all in God's timing, my sister.
Yes.
God
yes.
has a plan and a purpose for us all, and this too shall pass. So there's
yes.
ways you can answer them, but in the beginning, for the first few couple of years, it was extremely difficult.
I can
And
imagine.
Yeah, it just made me realize how insensitive people really are.
Yeah.
Yeah.
Very true. So you know that we have Kim in the house here this morning, and we actually want to ask Kim to just take us through her story, living with endometriosis. This thing goes around my tongue. You know what I'm saying? So we're going to just ask Kim if you can please just tell us your journey living with this, and how you find it, and how it is, and the pain that goes with it. So I'm going to give the opportunity to Dr. Mary and to Kim to actually take the show over this morning, right? Because it's actually, that is why I am so privileged to know someone like Dr. Mary, as a gynecologist, just to be on the show here and just take us through this, whatever Kim is going to say, Dr. Mary, that you can just, guide the people out there. I'm going to give it totally over to you guys. I will now and then come in and just ask whatever comes up in my mind. So Kim, you go ahead. Tell us a little bit.
Thank you so much once again. So basically, just to enlighten a few people, because there's a lot of people that don't understand what endometriosis is. So endometriosis is basically the uterus. There's a tissue in the uterus. So the tissue is supposed to grow within the uterus. Now, in my case, endometriosis is where the tissue grows outside of the uterus. So basically, it will grow on the ovaries, it will grow on the fallopian tubes, it will grow anywhere in your body.
Yeah.
So basically, 1 in 10 women ends up with endometriosis. 1 in 3 women has it in other parts of the body.
Really?
Which, in my case, it moved up into my lung, causing my lung to collapse on 2 occasions. So globally, like Joan just mentioned earlier, that 176 million people across the world, women, go through this. But only 1 in 10 experience it, and 1 in 3. So you can imagine my rare case. So in my case, I was diagnosed with this disease in 2014. I got married in 2010. And obviously, like any other couple, first
Absolutely,
2 years,
yeah.
you want to enjoy the marriage, you want to have fun. The 3rd year, we decided, no, wait, we want to have children.
Yes.
The 1st year, nothing happened. Everything was okay. The period was normal. I felt amazing. Everything was fine. But the baby just wasn't coming forth. So we obviously went to see different doctors, and that's when they discovered, hey, there's these lesions growing on your ovaries. And that is when they discovered it was endometriosis, because now it's bleeding outside of your uterus instead of inside of the uterus.
Okay.
And ever since then, I did my first laparoscopy, which was in 2014. And after that, it was a nightmare. It got worse. Every month was a nightmare. I had back pains, pelvic pains. I couldn't eat. I couldn't work. It was just a nightmare. So ever since then, I've been going to doctors. I was still hopeful. We believe in God. This thing shall pass. Everything will be fine. But then the second year became the third year became the fourth, and then I started seeing various doctors. And that's when they said to me that, people didn't really know about endometriosis.
Yeah, it's
That's
true.
the one thing I discovered.
Yeah.
Our doctors are not really equipped. They're not really well equipped. I wouldn't say that they're not equipped. They're not so well informed about it. So this one would send me to that one. And for years, I went from a stage 1 endometriosis, which was mild, to stage 2 without me knowing, because no doctor could really give me the information that I deserved.
Honestly?
And I always say deserve because every woman, I believe, deserves proper medical care and proper attention before it gets
It's
to
a
where...
fact, yeah.
So I basically went from a very early mild stage to a stage 4, and that is the reason why I'm here today, is to bring awareness, to stop that woman from going through what I've been through, from going to pillar to post, and preventing it from going from stage 1 to stage 4, and that's where I am at today.
Right. So yeah, Dr. Mary, you can go ahead.
Thank you so much, Kim. Already I've learned so much from you, but I'm just going to probably ask you a few more questions so that we can have a little bit more understanding as well, and for our viewers to have an understanding. And I thank you for consenting to me asking you some deep and personal questions with regards to this. And if a question does seem uncomfortable, you can just let us know, and then we can take it from there. But just already from an important note that you had raised, and you highlighted it so nicely, is that, yes, the condition is not well understood, but it's important to also mention that it depends where it is that you seek help, because anywhere in the world, there are different levels of healthcare. And in that, there is a referral system. And yes, if the symptoms can be very misleading with any condition, particularly with females, and so if you're not comfortable, and that allows within our healthcare system as well, where you can, if you're not satisfied with one particular doctor, you can go, or physician or healthcare practitioner, move to another one. But what is important to know is that each discipline is very, in medicine, it's very broad, but we've also got specialities. And what is important to note that endometriosis is treated primarily by a gynecologist. So when you're at a primary care health level or seeing a general practitioner, you might find that difficulty. So it's important when you are having female related issues to attend to, or to go to a gynecologist. So that is important. I wanted to highlight that in your discussion. So I wanted to, let me pass to Joan, if you'd allow me to just ask these questions.
Yes, you can go ahead.
Thank you.
Question. Is it difficult to pick it up, though? Because as Kim rightfully said, that she was at stage 1. So which means if a doctor picked it up there already, don't you think that it was going to be different now?
It's a very progressive condition. And also in terms of the management, which we'll come to a little bit later, because that I will ask as well, is that you'll see that it varies according to the condition and the stage. And like I mentioned now, is that it can progress. It's not a condition that is a standstill, because you are continually having hormones in your reproductive age, and you're continually having a menstrual cycle. And this I will address as well in terms of what are the theories of how women develop endometriosis.
Okay.
Yes.
You
now you can
then go ahead with your questions with to Kim.
To Kim. So Kim, I wanted to find out, what is your current age?
I'm 35 at the moment. Yes.
And you were diagnosed in 2013 with endometriosis?
2014.
2014. And how old were you in 2014?
Sure. How old was that? 20, 26?
At the age of?
24.
24.
Yeah, so she was 26.
Yes.
28,
26.
26.
Yes.
Oh, sorry, 26. Yes, 26. Okay, excellent. And prior to 2010, were you having a normal period?
Everything was
I
fine.
never ever experienced issues before. It was just when I got married, yes.
Okay. And just on that, so you were having a period every month. You didn't have any lower abdominal pains?
Pains, very mild pains, yes, I have.
Pains related only to your period?
Correct, yes.
Correct.
After your period, did you have pain? Before or after your period?
No, no pain, only on the day, usually actually only on the first day. Yeah.
And how many days were your period?
They were initially 7 and then it went to 5 and then 3. Yes.
Okay. And you were having a menstrual period every 28 days, 28 to 30 days?
Yes. Correct.
In terms of the flow of your period, did you have a heavy flow, or was it like when I say heavy flow, you were experiencing clots?
Oh, no
No.
clots. Everything was fine. Everything looked normal.
No
Good.
heavy bleeding.
Good. I just want to go back to the pain question. From a scale, we call it a pain scale, from 1 to 10, where 1 is just a slight knock on the side of a table to almost no pain, to 10 being compared to be hit by a train. What would you describe your pain level as
Currently or back then?
back then?
A 5 to 6. Or maybe just 5. Not even a 6. 5. Yeah.
That's a moderate pain.
It was
Did it stop you from working?
Excuse
Or
me?
go-
Oh, yes. No, back then, no. I could still do everything that I was busy with. So school work wasn't affected at all back then.
Yes. All right. And that is also a critical thing when it comes to endometriosis, is that, or when we're thinking about lower pelvic pain, just for our viewers and just to give them a bit of context as to why I'm asking these questions, it's important in terms of age when you start your menstrual period. What are the pain levels are you experiencing? Whether you're experiencing so much pain that it limits you from doing your activities of daily living. The next important thing is to then also recognize in terms of the flow, because when endometriosis comes about, one of those is actually retrograde, meaning that it, instead of the menstrual cycle flowing out through the vagina, it flows backwards through the fallopian tubes, as Kim has mentioned earlier, and it actually then sits in the fallopian tubes, goes onto the ovaries and into the pelvic cavity, and that's how you actually have those deposits into there. So some of this history helps us to guide us into that as well. An important thing is, like you've mentioned, Kim, is that when you started, you really recognized a problem when you wanted to start falling pregnant. And that's when you started doing the investigations, because your initial, from puberty to your time of actually now wanting to fall pregnant, that's where you found that there was a challenge. Am I correct?
Correct, ma'am. Yes. Correct. Yes.
Now I'm going to ask you a question on intimacy, because now you're in your married period. During intimacy or sexual intercourse, did you experience pain during sexual intercourse or discomfort?
In the beginning, not at all, but
Was discomfort, yes.
This is an important question for our viewers as well, and Joan, is that one of the elements that you can discuss the uterus and the ovaries, or the structures of the female organs, is that once there's sexual sex and the penis actually penetrates to the posterior part of the vagina, we call it dyspareunia. And that is pain on deep sexual intercourse. And that causes significant pain during intimacy. And that is one of the key features. So if you can see already there in that first part of her marriage, or the first 3 years, she hadn't complained of that symptom. And the one thing that led her to go to to seek help was infertility. And that's one of the key things that we then also should take note of, is to now investigate what are the reasons why she's becoming infertile. What was the next step when they found out that you could not fall pregnant, Kim? How long were you trying before you consulted?
So we were trying for a year, and we went to see a practitioner, and he said to us, it's perfectly normal. You're still within your time, and therefore he gave us time. So thereafter, it was about 2-3 years later, and still nothing happened. We went back and forth, but in between all of that, I had 2 operations for a Bartholin cyst. So I had 2 Bartholin cyst removals.
So
And
what is a Bartholin cyst?
maybe the doctor can explain.
What is that?
So a Bartholin cyst on the vagina, on the labia, the lips of the vagina, on the outside surface, that's what one would see. There are some glands that come out towards to those lips. And one of those glands is called the Bartholins. And so if there's a blockage of that, you can get either a cyst, so it's a collection, a fluid collection of that cyst, of that gland, and it blocks and it starts swelling up. The same if it becomes blocked and there's an infection that happens, and that then becomes a Bartholin's abscess. So then the management is, well, the presenting complaint is swelling of either the left or the right side of the labia majora and minora. It can happen. If you leave it for a long time, it can actually swell right up to the mons pubis. That is the part that is covered with hair on the surface, that when you look directly at the mirror, you can see. That's how significant it can be. Also, pain is a significant part of that. So then what happens is the management is the same. It would be to wait for it, like any abscess, to be ripe enough. Unless the pain is significant, it can either burst on its own before coming to a doctor, to a specialist, or to the hospital or the clinic. Alternatively, it can also be done in theater, where we have to do an incision and drainage, give antibiotics.
Dr. Mary, the reason why I asked you to just explain that is because a lot of people don't know the medical terms, right? So it's actually very important for us just to bring them into the picture. And then also, I know there was a picture of Kim when she now came out and she started sharing a story. And I just wanted to just share with us, because I saw there's quite a lot of pain that goes with this. I saw her once crying because of pain. So if you can just take us through what happened to you, when that pain is so severe.
Okay, so thank you so much, Joan. Thank you once again, Doc. Basically, your whole life is affected. Everything, plans, dreams, marriage. No marriage is normal.
Really?
With this kind of disease.
Yeah, that's why there's so many people who actually
don't make it. Their marriages does not survive. So I publicly want to thank my husband and every other man that is sticking with their wives and daughters and cousins or whoever. If there's a male involved, I salute you.
Oh, yes.
Because it takes a real man to be able to walk this walk.
Oh, yes.
And I would love to thank you, Delon. He's been amazing. He's been walking with me every step of the way. You can plan an event. You can be at a wedding. When your period comes, it comes. You might know the day, but you don't know the time. And for me, it feels like there's something that breaks loose in your body.
Really?
Yes. I couldn't even walk on my heels at one point. I wore flat shoes because...
So you must have sanitary towels all the time?
Not necessarily sanitary towels, but painkillers, yes.
Yeah?
To a point, I drank 5 tablets at a time on an empty tummy because you can't eat. So you'll take painkillers to suppress the pain, but it doesn't even help. There was a time every month I would be rushed to the doctor's rooms because I needed a pain injection. There's times I can't walk, I must grab, I must hold my womb, literally. And I'm saying this, once again, I'm creating awareness.
Wow.
I've been through it. I don't want any pity. I don't want any feeling sorry for me, because I know and understand my body better than any doctor. I know when and what is happening. Even currently now, I'm due for that. But it's on a much lower threshold than before, because I've been seeing a very good doctor. And like I said, I understand my body, so I know what to do now. Like in the past, I was caught off guard all the time. I would be at a wedding, my husband needs to take me home. Funerals I couldn't attend. Like Pastor Joan mentioned, at one event, you saw me crying. It was at our it was the graduation at church. That day, I couldn't even stand on my 2 feet. And you don't want to miss events. You want to live. You want to be a part of life.
Absolutely.
You want to be part
You're
of
still
society.
young.
I have so much drive, but
Yes.
I just can't. And I couldn't even, you're so embarrassed at work because you're amongst males.
Yes.
And they don't understand what's wrong. One moment you up there, the next moment you like, I need to go home. You can't even drive yourself home. I remember once driving and I almost hit the side of the road because I was out of it completely. And only now when I understood the symptoms, I knew that fatigue was one of it. And I would literally doze off. And people never understood it. They actually thought that it was a myth, that this girl is over-exaggerating. She's finding excuses to be at home. It was just crazy.
Wow.
It was crazy.
It's really like bad, huh? I didn't
Extremely
realize
bad.
it's to that extent. To be quite honest, I didn't.
No, it's very bad.
I know with myself, I used to faint at school, and the teachers knew already. They knew when it's the day before, with my menstruation, with the cycle, I used to faint all the time. No. Even when I was at the gynae with my first child, the doctor knew. I just used to pass out because of the pain, So I don't know, Dr. Mary, is there something that the mouth of the womb becomes also when it's too small, or how do you really, what's the causes of this thing, and also how do you really treat this thing? Is there a cure for it? Someone like Kim now, is there hope? Just the realness in this thing, so we can understand. Is there hope? You know what I'm saying? We know there's hope in Christ. Yes, that I know for sure there is. But with the medical field, with regards to endometriosis, is there hope? Is there a cure?
So yes, there is hope. And like Kim's journey, there will be something that will alert and alarm us to actually act and to work. There are different modes of management, of treatment. We can go from conservative management all the way to surgical management. And what I like, Joan, is that you've mentioned that one is that when you're a teenager and you're experiencing these difficulties, is to speak to your parents about it and to actually ask, can I go and see a doctor? And that starts with your family practitioner, your GP, because yes, we are talking more openly about endometriosis, and especially in young girls who experience such difficulty, we want them to come and access. If you don't have medical aid, we still have a strong public sector that allows for our clinics to be utilized for this particular condition. So there is hope, and I want that to be very clear. I'm just having images now of Kim, and she's absolutely beautiful, and she's sitting here and she's expressing that she has this hope and this joy every single day. It's not easy, and yes, you do find yourself going from one pillar to post initially. But once you find that physician that you can connect with and walk with, your journey becomes so much easier, because then you know that you've tried everything possible to do that. And like we've mentioned, that there are different modalities from a young age, all to the point where we say that you've completed your family. What are the more invasive methods of doing that? Do you want me to go through some of that now, Pastor Joan, or should we ask Kim what she's done so far?
Because in this whole situation, I don't know whether a doctor actually told Kim the same, but in this situation, I find that they feel that when you're on contraceptives, that it actually eases the pain. But if you really want to have a child, you cannot go on contraceptives. So which means you must live with that pain. You understand what I'm saying? So is it like that you have to go on contraceptives to ease the pain?
I was given the option to go on contraceptives on numerous times. However, because we wanted a baby so badly, I never wanted to go that route because it's going to set me back. But initially I thought, maybe I should have done that, because you're always asking, should I have done this? Should I have done that? Should I, so until you find, like Doctor mentioned earlier, a good doctor that can advise you, you don't know the disease.
Absolutely.
You don't know what the next best thing is. So then maybe 1 month you'll try the contraceptive, the next month you end up with 3 cysts, the next month the following month. That's why your hormones are always like this, because people are always trying something on you to see if it will possibly work. And that is why I find myself on this level, because I realized, there's really nobody that, and I really don't want to speak bad against, our doctors. We love them, we appreciate them. But in my situation, I was literally given almost like a guinea pig. Try this, do that, cut here, do that. And it caused a lot of damage.
Right. So Dr. Mary, yes, you can go ahead.
Thank you so much, Kim. I think it's important to know that with endometriosis, it's not a quick fix idea. It is a process, and one of that is by starting conservative management. So one patient might feel like a guinea pig on one hand, but the same treatment might be the first line and the only line that they use. And yes, of course, it depends on their stage of endometriosis. The first thing that I want to say, for some women, basic analgesia, your Panado and Brufen, it can work to help them to overcome the pain and the anxieties that they're having with regards to the endometriosis, or what we call dysmenorrhea. Dysmenorrhea is severe pain that affects the activities of daily living. Like you mentioned, going to school and having pain, going to work. So those periods where you're not able to function because of the pain, but there are women that can just stay on that. The next is medical management, where we use a contraception. And this is important to have that discussion with your gynecologist or your GP, is to find out where you are in your reproductive phase. If you want to have children, yes, contraception might not be your first option. But the beauty about this is that we can use oral contraception, combined oral contraception, because the driver for the driver in endometriosis is estrogen. So if we can use estrogen and progesterone, so it opposes the estrogen, it can balance the hormone. That helps reduce the pain. It helps reduce that effect that what's supposed to be happening on the inside of your uterus is subdued, as well as subdued outside of the uterus. So that's the key thing with thing. And yes, 1 month is not sufficient to use contraception. You need at least a period of 3 to 6 months to really get an effect. Again, what works for one patient might not be the same. It requires a lot of patience. So that's why you need one doctor that's going to work with you. And that's why I often advise our patients who come in with pelvic pain that we are doing a workup. If you're in the public sector, it takes a little bit longer because it's not just up to us. In the private sector, it's different because you have access quickly to different modalities like ultrasound, like lab scope. In public sector, we service a lot more people and things take a little bit longer. But the process is the same. That's key thing. The next thing, the gold standard of checking whether or not it is truly endometriosis is lab scope, which Kim had mentioned she got in 2014, which is also, it's the gold standard in terms of diagnosing and treating. Diagnosing is to identify, and I submitted a picture in terms of what the different stages look like, and hopefully we can look at that. But in terms of identifying where the endometriosis is, how severe it is, that is lab scope. But the beauty is, while we are there in the abdomen already, we can then look at burning those structures. That is called ablation, or to remove the adhesions. Now, this is a key point here, is that when you do one lab scope, it doesn't mean it's the end. Because what happens? That retrograde movement of blood from the uterus into the fallopian tubes onto the ovaries is a continuous, it can continue. If you match the theory that through your embryological development, that means how you were formed in your mother's womb, the cells that are developed, it comes from the same pathway. If those cells are triggered to change, that can also cause, that might be difficult to manage in terms of a laparoscopic treatment, but still there's that option there for you. And then obviously with ultrasound, continuous follow-up. But what is important is to note that you might have to go back for repeated lab scopes. That's why you can find women say that they've had 10 lab scopes in order to manage that. And the more times you go to theater, you develop a condition called adhesions. Those adhesions are like tenting that happens within the structures in the pelvis. And what that happens, it causes a pull and a tug and pull on the structures, and that in itself can cause pain. So you see, we're trying to treat pain on the one hand, but we can also induce pain on the other in order to help. So you see with endometriosis, it's very tricky, very tricky. And even in women in the later reproductive life, like Joan has mentioned, you can go for hysterectomy once you complete it with your family, or if the pain is that severe that you cannot take it. But it doesn't mean that the pain is going to go away completely. It means now that you're going to have to adapt, either exercise, diet, including these modalities that I've mentioned in order to help. So Kim can direct us as into these modalities. As she said, you try one thing, you move from one thing, you try another thing, because we really need to end up individualizing the management for our patient.
So what would you
in a situation like Kim, because Kim, you do exercise and stuff like that?
I exercise all the time, but for a period I had to stop because I just couldn't. Even now, I have a lot less energy than I normally do. So because of my 2 lung operations, remember I had 5 operations already in total.
Wow.
2 Bartholin, 2 lung collapse. So my body has had on above 10, on a level from 1 to 10, I've been finished like Joan. I was done. I have no energy. I had no energy. I actually speak life. I have energy, but my body's just not on, normal.
Yeah.
But I push myself beyond.
Yes.
I refuse to lay down. I refuse not to go to the gym. So I will do my cycling.
Yes.
I will do my walking, my swimming, my aerobics, whatever I have to keep myself intact. But the energy levels, I can't just lift the weight like a normal person.
Right.
Even when I sleep, my breathing is, but it improved a lot because it also speaks a lot about your mental capacity,
Yes, absolutely.
your mental health. How healthy are you? Because these things can actually destroy you.
Absolutely.
If you're not strong enough,
No, it's true. You can give up.
You can give up easily.
Yeah.
And hence we mentioned earlier, marriages don't last.
Yes.
Because if the one has lost all hope, the other one feels, what's the use of me sticking around?
Yes.
So it's a constant battle in my mind. Even when I'm in that pain, I literally tap myself. Come on, girl, you've got this. Get up, get a bath. There's times I can't even walk. I have to be carried. Sometimes the steam of the bath is so bad. I must wait for my husband to fetch me. And I'm saying this once again to encourage, to motivate, to say, ladies, it's tough, but you can. And you have to tell yourself that you will. You have to speak to yourself constantly. Even
Right.
being here today, I'm in that period now, and I'm open about it because I'm really here just to create awareness and to tell
Absolutely.
that woman out there that it doesn't matter what you go through, you can push yourself. You don't need to lay down and to feel sorry for yourself.
Right, right.
So yes, that's basically it.
So,
Five operations first.
so, which means with the lung operations, why did you have the lung operations? If you
So-
can explain.
So yes, going to the GP, they can't find my breathing isn't normal. My lung is filled up with water. Nobody knows where it's coming from. We not certain, but immediately I had to go for an operation. 10 days in ICU. The first in 2019 November. That was my first. I went for an operation. Nobody can find out. Everyone is not sure what's going on. Remember now, it's a severe case, but they're not aware because they're treating the lung. Meanwhile, it comes from the womb.
Oh my.
Because the water here, it can't find a way, or the blood, because it's mixed with, it's your blood basically. It needs to go out, but mine is stuck in here. So it's finding a way in your body. Your body's trapped with this liquid, with this fluid rather. So it found a way and it pushed its way through
To the lungs.
to the lung, and that's when my lung fell the first time. But nobody knew it until now, recently, when we discovered, well, you know what, this thing is actually linked to your endometriosis. That's why I said mine is quite
Oh my word.
was life-threatening
Oh my
on 2
Lord.
occasions. So, yes. And that was the first one. And then in August last year, in the middle of COVID, I, in August, had the same thing, couldn't breathe, went to the doctors, had no energy, was carried in, again, same thing, ICU, 15 days again. 2 weeks later, came out, guess what? I got COVID. And your lung is the most important, you know,
the
when
devil
you've got.
is a liar.
So I was almost kicked out on 3 occasions, literally. Yes, but I'm here.
Yes, you're here, girl.
Yes.
Dr. Mary, what is that? Please explain to me. I never, ever. This is the first time I heard this from Kim. You know, so I know that endometriosis can attach itself, right, anywhere in your body. But now, with the lung situation and the fluids that cannot find or can't be channeled out, what is happening there from a medical perspective?
Yes, Kim, you are really a warrior woman. I salute you. I salute your husband. How amazing is your life, and what a testimony you have. Sure. But just to come to the question, Pastor Joan, what it is this, what she's describing is another theory to explain endometriosis and how it spreads to the different organs. Yes, if our producer can put up a picture of how endometriosis looks, it's on the definition slide. That one is just what it looks like on the outside of the uterus, the fallopian tubes, and the ovaries. But through the one theory, it's called embolization theory, is what happens is that the endometriomas, this tissue-like that's inside the uterus, actually travels through through the lymph structures, as well as through the bloodstream, and it implants itself into other organs. And the one of that is the lung. And like Kim is saying, that is such a rare occurrence to find. And one of the things to do is to actually take that fluid out and test and see. And we don't often check for endometriosis in that fluid because it's not something that it can be easily detected. But one of the ways that one can actually, if it's diagnosed by lab scope and the person presents now with no other features like TB, like no other conditions like a cancer, one of the things that one can do is then to say that the most likely, because it's by exclusion, that if they have endometriosis and they present with a lung feature, then it's most likely then to be endometriosis. How can then we then help diagnose it? One, it's through a CT scan, better yet MRI, and then also by what we call a gastric sorry, no, I'm now talking gastric, which is stomach, but it's a lung, pleural lavage, or into the lungs. They do a scope and they're able to take out where they can see this endometriomas, and then go and test that if it's similar to that of the uterus. Very rare condition, like she says, 1 in 3 people. So definitely, if we have to say, God is great, this is one of the things for her to survive this type of thing, because one of the things that they present with similar to is that of TB, where they start coughing blood. That would also be where we can take that specimen and test and see if that is an endometrioma. Another condition also in gynecology is called where you have gestational trophoblastic disease. That's where you have a pregnancy that doesn't develop very well, and it actually is just cells. But a cancer form of that can then actually spread to the lung. So that's also a very common presentation that you find in females who have that type of condition.
Right. So even with her situation, having those 2 operations with the lung story, how's your situation now?
On a scale of 1 to 10, I must be honest, I'm on a 6. It's manageable. I'm able to do 1 and 2 things because of the meds that the practitioner gave recently, and he drained some water. So instead
are you under a gynae?
Yes, I am.
Okay.
I am, and by the grace of God, I am so grateful, because like I said, if you don't have, and that is my concern with every other girl out there, do they have the care? Do they have the hot water bottles? Do they have warm baths? Do they have sanitary towels? And that lays heavy on my heart, because all I want is a hot bath for a few hours.
Yes.
I'll be fine because your muscles relax. And a warm hot water blanket, and I'm fine. But our girls don't get that.
Absolutely.
So right now I am under care, and it seems to be going well. I am scheduled for another a laparoscope, but yes, it's definitely come down from a scale of 1 to 10. It's gone on to a 6. Yes.
Okay, if I can just go through this before you go further, Dr. Mary, if you can have a question to Kim. There's so many shout outs here. A lot of people on this topic here this morning. There is so many women who says you are a strong woman, Kim. So proud of you. Such a strong woman. Candace Sammy says, because Candace has actually had the same situation and eventually adopted. How many children does Candace now have? 3, right? Wow. Adopted 3 kids, beautiful children. Salome Mackenzie says, I'm so proud of you, Kimmy. Juanita Edwards says, I salute you, Kim, for sharing this with us. You're a real warrior indeed. Zinnia Constance says, so super proud of you, Kimmy. You are a strong and courageous woman. And then Janine Bronco say, so informative. Thank you for sharing. My girlfriend, Pastor Eileen Peilman says, thank you, Pastor Joan, for this show. And there's so many women that I know of who's going through this and who have endometriosis, and so many of them don't even know. They just take it as they're infertile, and because what can you say to women like that?
Pastor Joan, and that's why I said earlier, I mentioned the thing about the generations.
Yes.
The previous generation was a silent generation, with all respect.
Yes.
You were afraid to speak, you were afraid to come out. Now I'm saying to every young woman out there, speak out.
Yes.
You are your story, you are your pain.
Absolutely.
Stand bold, come forth, educate yourself, know your body. I mean, for me, even my diet has changed. Everything, I can't have animal-based products. I'm not allowed to have sweet things. I'm not allowed to have, I'm allowed to eat vegan, yes, because it prevents the bloating. It prevents me feeling, uncomfortable. I feel good when I eat plant-based. So I had to study my body to know that. I had to research. I had to find out more what works for me, because the reason for some of those levels was trans fat foods. heavy pizzas, cheese, oils, all those funny drinks, the norm. And then I realized, hey, this increases my pain levels. The more I eat closer to that time of the month, so now I need to cut down, and it works. It works. So there is ways that you can, study your body, young woman. You don't have to go speak to somebody. Find a way. Don't sit and keep quiet, because what I discovered was some of the ladies, when I did that post, came 55-year-old women, 6 years. They up till today, they don't have kids. Because nobody took the time to hear them out.
Yes.
Nobody, eventually,
Very true.
when you go from pillar to post, you decide, you know what, this is what it is. It's not what it is. It doesn't have to be. Medical is out there. Things have improved. We're in a new era. There's a lot of new things. Fourth industrial revolution. We can get help, but you have to speak out. And that is my advice to a young woman.
Wow, awesome. Well, I don't know what happened to the time, because I feel like we just started. But apparently our time is gone. And I just want to thank everybody who listened. And I'm going to ask you to give your last remarks, Dr. Mary, and to Kim. But allow me quickly, Leandra, if you don't mind, just to read. Victoria Twala says, and that's Jabs. Kim, I salute you. You are a real warrior. That setback is now your comeback. And I agree. Raylene says, thanks for sharing, my friend. So proud of you. And I always tell you, you're such a strong woman. Love you. Warrior, God will restore. And then Finette Frederick says, what an informative show. Proud of you, Kim. Well done, Pastor Joan, for setting up such an informative show. I have learned a lot today. Thank you so much. Now, over to Kim. We're going to ask you to give your last remarks. And then Dr. Mary, if you can give your last remarks. Thank you.
Thank you once again, Joan. Just to every young woman, every old woman, every age group, age gap, any woman out there, cousin, sister, friend, speak out. It's important. You don't have to go through it alone. You are not alone. We are together. We're in this together. And I love you and I appreciate you, warrior. Any other situation other than endometriosis, if you've been through it, you can go through it. You can fight anything if you just set your mind to it. So just find somebody, speak to someone, and once again, you are not alone.
Amen. Dr. Mary.
Thank you so much, Joan, for this opportunity to be here and to share and to walk this journey. I know it's not even a touch, it's just a blimp. And for Kim as well for sharing your story. Endometriosis, definitely, like we said at the beginning, not well understood, sometimes not spoken about. But what is important is that you've created this platform and allowed for this discussion to happen. And rightly, like Kim has mentioned as well, is that there are so many platforms that we can use now. Don't be afraid, young woman. Don't be afraid, mature woman, to come forward and discuss these options. And even with infertility, my last point on that is there are options available to you. Let's start that discussion and then we move forward the best way we can. Thank you so much for the opportunity.
On that, so we will have a show on that. Thank you so much for everybody tuning in here this morning. We really appreciate your time, and thank you to Kim for coming and sharing your story. You brought awareness to so many here this morning. Never give up, because I know God is in control. And remember, Sarah, that's all I'm saying. God is in control, and I know I'm standing with you in prayer and in faith. We are not moved by what we see from the outside, but we are moved by faith as children of the Most High God, because He's in control at the end of the day, right? And I know this story, this testimony is going to be a powerful testimony one day to the world out there, that God is able to do exceedingly abundantly above what we ask or even think of. Thank you to our Dr. Mary. I love you so much, and thank you so much for coming up. I know that even if Kim needs any info, if you can avail yourself just for her to actually get in touch with you to ask what is happening right now to my body, right? Thank you so much for always being available. I love you, and I know God's going to take you places, and He's going to give the good desires of your heart. Well, beloved, thank you so much. I love you. God loves you best. Go in the peace of the Lord. Mwah.
In the shade, as I look upon my life, in the shade, there's a passion inside. Heaven knows I'm living my dream. In the shade, as I look upon my life, in the shade, there's a passion inside. Heaven knows I'm living my dream.